Hello and welcome to a conversation on the Daily Bern. I'm your host, Eric Miller. Today I'm joined by a fierce and fiery fighting progressive from the great state of Massachusetts. How you doing, Dr. Robbie Goldstein? How you, sir?
I'm doing well. Thank you for having me on the show today.
Thanks for taking some time to chat with me about your background and your candidacy and your race. You're running against kind of a particularly egregiously, I'm just going to say terrible corporate Democrat. And we'll get into his record. And there's a couple points I know that you like to hit on specifically. And we'll get into all that. But a little bit about you. Can you just kind of in a nutshell, a bit about your background and what inspired you to run?
Happy to. As people recognize, I'm a doctor. I'm a physician. I'm actually an infectious disease doctor, and I work at Mass General Hospital here in Boston. I went into medicine for a very specific reason. I wanted to help people. I wanted to help communities. I wanted to take care of people. It's something I learned from my parents growing up, and something that I carry with me even into this political arena that I'm now in. But when I went into medicine, the idea was to work with those people that are most vulnerable and those people that have been left out of the system for a long time. And I built a career as a primary care doc, largely in the beginning taking care of folks who were living with and at risk for HIV, and folks in the LGBTQ community and people affected by substance use. In the past 5 years, I've had an opportunity to build within the hospital a transgender health program that was way more powerful and way more expansive than I could have anticipated when I first started. It was a program and is a program that has grown to now provide primary care and consultative care for folks coming in to our large hospital system. But I think more importantly, it's connected with people in the community, and it's expanded all across New England to help improve access to care for the trans and non-binary communities. And that work that I was doing is really what inspired this run for Congress. It was the idea of watching what happens when you shake up the system, when you create the structural change that you need so that the right thing can move forward. And the more I was able to have success in the hospital, the more I recognized we've got to do this, right? We have to do this at all levels of government and throughout our communities. And so I looked at this race in particular as one, and we'll talk about my opponent, the congressman. We'll talk about him in a little bit, but I looked at this as a race where there's an opportunity to bring some progressive values, to do what is right, and to really shake up the system a bit.
Excellent. So that the services that you instituted in Mass General, is that like how common are organizations like that within hospitals around the country? Is it leading edge? Talk about the accomplishment there.
I don't want to say that we were the first, because we weren't. There were other hospital systems that have created large transgender programs. UCSF has an amazing program. Mount Sinai and NYU in New York have fantastic programs as well. But I do think that we were among the first to think about this in a large academic medical center. MGH is the largest hospital in Massachusetts. We have over 1,000 beds. We have a lot of people coming in and out of that hospital. I think what is actually most unique about the MGH experience is that it's part of this enormous healthcare system that takes care of people from Vermont and New Hampshire through Massachusetts down into Rhode Island and Connecticut. And we've been able to expand care all across New England in a way that hasn't been done from some of the other centers that exist.
That's amazing. Yeah, and it's it's fighting against discriminatory practices, right? Which heretofore have been a real issue. And I think let's hit on it. I think there's something in your opponent's voting record that supported that. You want to describe that?
Well, I could talk about a whole bunch of things, but I guess I'll say there are two things in particular that I was fighting for and that he was fighting against. And this was during the time that I've been building my career. One is that he voted against the Affordable Care Act in 2010, voted against that piece of legislation that was intended to expand healthcare access to millions of people in this country. And throughout his career, he's had a very anti-LGBTQ stance. He got into politics back in the 90s explicitly to keep the LGBTQ community out of the St. Patrick's Day parade, has voted against marriage equality, has voted against so many things that to me are so important for the LGBTQ community. And so, I got into the race certainly because I wanted to shake up the system, because I wanted to create the change, but also because I recognized my own representative was not representing my values and what I thought was important.
Right. And you do not take corporate PAC money. That's correct, right?
I do not. No, I do not.
Okay. So naturally, being that he's an incumbent Democrat and he's anti-choice, voted against the ACA, the party would be more in favor of you because you're pro-choice and fighting for more progressive values. Is that correct?
Well, I'll say that the people who are registered Democrats here in the 8th district, I think, are more in line with me and are more supportive of me. And those are the folks that are going to vote and figure out who's going to represent the district.
Right.
I haven't gotten a call from the DCCC yet showing their support for me in this campaign.
Okay. I'm sure it's coming any day.
Yeah.
How about just, since it's the topic of the day and you're an infectious disease, physician, if I would be remiss if I didn't ask about, you're currently working on the COVID front lines. What would you like people to know about that?
Yeah, I mean, COVID it's so interesting. Right? We launched this campaign in November, long before, at that time, it seemed long before COVID, and no one could anticipate what was about to happen in March. We were talking about healthcare, and I was talking about disparities and equity and access. And in March, when COVID hit, the campaign message started to resonate in ways that I think we had hoped for, but hadn't seen yet, because everyone was recognizing the disparities in our healthcare system, the racism in our healthcare system. Everyone was recognizing the importance of healthcare, right? That healthcare is a human right, and you can't link healthcare access to employment. And we've seen the devastating complications of that over the past few months. But I think I had a really unique opportunity. I'm the only infectious disease doctor running for Congress in America. And I had the opportunity to be in the hospital and see patients and work in ICUs and watch what happened when we had to reuse and recycle our PPE, when people had to increase the number of shifts they were doing so that we could provide care for all the patients that were there. I could actually see the complications of a failed federal system on the extremely local level, right? One bed at a time in an ICU. And it changed in many ways the rhetoric, the messaging of the campaign, because I had that really unique experience. And now, we're still fighting COVID. Cases are still increasing every single day. And I think I have a better position, a better argument to make to say, who else do we want in Washington than an infectious disease doctor who's experienced this firsthand, helping us make these decisions about how we get out of this?
Right. Yeah, absolutely. Let's take a quick look at your district, right? Because we live in a time where districts are gerrymandered like a, obscenely ridiculous to an obscenely ridiculous degree.
You think this one's there?
Right. So this is so it's Boston, Massachusetts 8th. It's a +10 Democrat district. Brockton. What do you want people to know about your district? What do you want to sort of brag on? Or
there are a few things about this district. I think that this is an incredible district that represents a lot of diversity, but a lot of people with shared values. This is a district that 20 years ago, when Congressman Lynch was first elected, probably did represent the same values that he talks about. It was a more conservative district back then. But as you pointed out, it's now a 10+ Democratic district. It is reliably a Democratic district. It is a progressive district. This is a district that wants to have a conversation about single-payer healthcare, wants to talk about the Green New Deal, wants to talk about racial injustice and how we address systemic racism in our country. You can see from this map how much of the district is all along the coastline, right? The Green New Deal is real to folks in this district because they're experiencing what happens with rising tides every day. But you can also see that in the district, you talked about Brockton. Brockton is an area of Massachusetts with some of the highest air pollution. It's also an area of the district and of Massachusetts with the highest number of Black and brown communities. And it's an area of the state and of the district with the highest number of COVID cases, right? And so much of what we talk about in the progressive agenda is real to folks in this district, and they recognize that we need someone who's going to fight for them every single day in Washington.
Right on. So the incumbent is Stephen Lynch is his name. When you do generally constituents, are they aware of him voting against the ACA? Are they generally aware that he's a Democrat? That's anti-choice. Like, what's the constituency's view of him from your campaigning, notes?
So I'd like to say that while Stephen Lynch is someone who has been reelected for the past 8 elections in this district, he's not well liked across this district. There's a strong contingent in this district from the congressional primary electorate who will not vote for Stephen Lynch. It's about 25% of the vote either leaves his name blank or votes for his challenger. But there's an even larger percentage of the district that just doesn't know anything about him. Much of what we've been doing, in addition to introducing myself to folks in the district and trying to share my story and my message, is to just share the facts with him, to share that he is now one of only 2 Democrats left in the House to have voted against the Affordable Care Act. He is pro-life. He is outside the norms of the Democratic Party, certainly outside the norms of the Massachusetts Democratic Party, which is quite a progressive group here in Massachusetts. And so we are sharing with people not what he has done, the facts about his career and the facts about his votes.
Right on. And I looked up his open secrets, and I think less than 1%. It was like 0.084% is from small dollar contributors. So, the vast majority of his donors are, just can you talk about his donors?
Yeah, I was going to say, I'll take it as an opportunity to say, this past quarter, we outraised him 4-1, which I think shows a lot of our momentum. But I will tell you, all of our donations came from individuals, none from corporate PACs. He had 8 donations from individuals in the last quarter. 8. And the rest came from corporate PACs and political PACs. And, I think it's just a representation of who's funding the campaign, certainly, but who is driving the campaign, right? My campaign is a campaign that is driven by the people and communities all across the 8th district. His is a campaign that is being funded and driven by corporate and special interests. And that, as you know, that matters. That matters in how people vote. It matters in what people do and how they're able to lead in Washington.
Yep. You mentioned, I guess there's the makeup of the district. There are urban areas or there are rural areas. What aside from the sort of tentpole issues, Medicare for All, Green New Deal, how are the issues? How are you targeting issues to particular, segments of your constituency?
Those 2 issues are certainly number 1 and 2 wherever I go all across the district. I'll add that there has been a robust conversation dating back to when I launched the campaign back in November about racial injustice and systemic racism all across the district. And the other thing that this district cares about deeply, although recently we've talked about it quite less, is transportation and traffic. This happens to be a district where a lot of people commute into the city of Boston for their job, and they are on roads and infrastructure that are outdated and can't handle the volume that is going through. And we have a failure of our public transportation system to pick up the gap, really to fill the gap there and make sure that people can get to where they need to go. So we have a really robust conversation around transportation. Most recently, people are using Zoom and other ways to transport themselves into work, so it's less of a conversation, but I think it is something that people really do care about here.
Right. And that would be part of a Green New Deal, and there would be, can you talk maybe about, I guess Boston is notorious for big dig, and transportation is probably a hot button issue, right? Can you talk about, the transportation upgrades you're talking about in the context of a Green New Deal and a just transition associated with that?
Yeah, well, I think, and let's talk in particular about this particular district, right? And I mentioned Brockton before. I think Brockton's a really great example of a city that is actually only about 35 to 40 miles outside of Boston, but it can take around 90 to maybe 100 minutes to transport yourself between Boston and Brockton. And that is an unreasonable amount of time to go such a short distance. It's largely because we have not built the public transportation system to get people from Boston to Brockton and back and forth. So we certainly have to invest in that transportation system. But I think even more importantly, in this district, there are a lot of folks who want to invest in local transportation, sidewalks and bike lanes, making sure that we can utilize our communities better. We can get around our communities and not have to drive for very short distances. That's true for many people all along the South Shore, that part that's along the coast. That's true for people who are more inland, where they just feel that they are forced to use their car. They are forced to add traffic to the roads because we haven't built a system that addresses people's needs. And that, as you said, right, that's all part of the Green New Deal. It's this idea of thinking incredibly locally, but then also thinking in the more global and broader picture.
Yeah. And I always like to underscore the just transition component of that, because people often look at, the corporate media will be like, how are you going to pay for it? Big price tag, and they shy away. But, the impact is worse than not taking any action, and the cost is gradual, and there's a just transition, there's retraining, there's all that kind of stuff.
Absolutely.
So, I like to, allay concerns by, communicating that. Let's talk a little bit about Medicare for All. Obviously, that's your field specifically.
My lane.
Right. Can you describe, I'm assuming you would sign on to Pramila Jayapal's bill.
Absolutely. Right. And I think this crisis, the COVID crisis, has made us all realize that the importance of healthcare is so much bigger than what we were even talking about 6 months ago, 12 months ago. We absolutely cannot have a system where health insurance is linked to employment. We can't have a system where the color of your skin determines the healthcare that you receive. We can't have a system that the state you live in can determine whether or not you receive healthcare in this country. The only way to address those issues, and what I would say are the three biggest issues in our healthcare system, access, cost, and equity, is a single payer system. A system that can guarantee access to everyone, can control costs in a meaningful way, and can begin to address the systemic racism that exists in the healthcare system. And so I think Medicare for All is a bill that gets us there. I think there are ways we can make it even better, and I'm excited to work on that and to move it forward from where it is. But certainly we've got to start there and then keep building to try to get the best healthcare system we possibly can.
Right on. Can you share anything like anecdotally from your unique professional perspective that that maybe the rest of us wouldn't see? I obviously am supportive of Medicare for All. My viewers are as well. But, what do you see that just like keeps you up at night, or anything anecdotal that you want to share?
Yeah, I think there are two things that I'll share. And I'll frame it with the fact that I live in the state of Massachusetts, which is a fantastic state when it comes to healthcare access. We have really been on the forefront of making sure that people can be covered. But even here, we have issues. And there are two things in particular that I see as issues. One is that this link between employment and healthcare is felt even here in Massachusetts. People who have a job that may be based outside of Massachusetts have a very different amount of coverage, right? They have very different plans because they're outside of Massachusetts. And in many ways, they're being discriminated based on the job that they have taken. And that is not tenable, right? That means that I see patients who come in who won't have access for basic services that I think are necessary. Now, certainly in my transgender health practice and that program, that means denying people coverage for surgeries or for hormone therapy or for mental health care, or you name it, simply because they have a job in the state next door and not here in Massachusetts. The second thing that I see a lot with my patients that I think really drives for me why we need to address the underlying issues with healthcare is this problem of underinsurance. We certainly have a problem with uninsurance, those that are not insured in this country, but we have an enormous problem of underinsurance. And it has created a system where people can go in and need care, need services, and can't afford those services even when they have health insurance. They can't afford the co-payments, they can't afford the deductibles, they can't afford the co-insurance. They're not able to pick up their prescription medications because of all of those. And we are lulling ourselves into this false sense of security that because someone has an insurance card in their pocket, they're fine, right? And that they're not fine. They're underinsured and they're not prepared for whatever may come. So I think it is clear to me in working with patients every day that we've got to make sure that we have universal access. Everyone has access, that we have provided care for every single person, and that we're providing that in a way that people aren't scared of the costs that are coming back at them.
Right. And when you say access, that's an industry buzzword, right? You mean it literally in the context of Medicare for All, universality, right?
Yeah.
Yeah. So what is, I didn't look at Stephen Lynch's website on this, but I'm assuming he has boilerplate, everyone deserves access to quality and affordable healthcare on his website or something similar.
Well, I'll tell you, he hasn't updated his website since 2013. So I'm not sure that whatever is on the website is reflective of his current belief in healthcare. But he, as I said, he voted against the Affordable Care Act. He has talked in the past about expanding coverage, but hasn't given a really great explanation as to how you expand coverage. He certainly hasn't signed on to Medicare for All, and is not talking about a single payer system.
Right. Yeah. And I think I saw the numbers, like 90% of Democrats approve of Medicare for All. And why would you oppose it during a pandemic? It's politically wrong. It's ethically wrong. It's only right. All right. It's only right by the donors, right? I'm assuming he has health insurance donors or whatnot. Is there anything, since we're still talking about him, any other, so you mentioned the three, are there any specific votes that he took that you can link to a donor?
I actually, off the top of my head, I can't give you one there. I assume and think that the ACA vote, the vote against the ACA, likely had to do with some donors and his political allegiances there. But in particular, I think it's hard. I will point out that he, in this Congress, is sitting on the Transportation Committee, and many of his corporate donors are from the aviation industry. And I think here in the district, there's a pretty big issue. It's a local issue, but it's a big issue for folks here, which is the pattern of traffic overhead. There are neighborhoods all throughout the district that hear planes all hours of the day, and we've been unable to address that issue and address the sound that we have. And I think some of that probably has to do with the aviation industry not wanting to put in the necessary regulations to address the sound. And they happen to have someone who sits on that committee, represents this district, and receives their money.
Right. So he's, I'm going to put it more succinctly because I don't have to be as measured as you. He's paid to obstruct. I'm going to just flat out say it. So I'm going to pull up just a profile of you, just to, again, highlight some of your positions: single payer universal health care, racial justice, Green New Deal, gun violence, women's rights, ending the opioid epidemic. Do you want to, and I pull up a few endorsements: Andrew Yang, Our Revolution, Sunrise, Local Peace Action. Any of these positions, the gun violence, women's rights, opioids, that you want to sort of hit on?
I'll never give up an opportunity to talk about gun violence prevention, because I think it's incredibly important for us to have that conversation and for us to move forward. I will point out that I always want to have a conversation that is about gun violence prevention. We are trying to prevent violence. And I think we've got to, as Democrats and as progressives, we have to make sure that we are using the right language so that we can push forward with what are really broadly approved of common sense legislation, right? That is going to decrease the amount of violence on our streets, decrease the number of people who are killed by homicide or suicide as a result of gun violence. And, I look at this as a healthcare issue. I look at this as a racial justice issue. I look at this as a necessary crisis, an epidemic that we have to address with incredible urgency. It is something that I'm excited to work on, because I think we have the blueprint, we have the path forward, and we've just got to be very deliberate in our actions and make sure we pass each of those common sense pieces of legislation to make sure that our streets are safer, that we decrease the violence that happens from guns every day.
Right on. How about, when you go to your website, a nice Black Lives Matter pop-up comes up first. We talked a bit about racial justice in terms of healthcare and the environment. Can you talk about, criminal justice reform, where you stand on defund the police, private prisons?
Yeah, so I'll start by saying that I tend to use the phrase the criminal legal system and not the criminal justice system, because I think we don't actually provide justice in our criminal legal system right now. We have a system that determines your justice based on the color of your skin, right? So if we're going to actually create a system that provides justice, we've got to get to the root of the racism that exists there. This is a conversation that we've been having since November, but certainly we've been having it with many more people over the past 2 months as the whole country has begun to have this conversation and really dig in. I think in particular that when we're having these conversations, we should be going to the evidence and the data about how we address racism in our system, right? And the evidence.
It's good timing for a siren to go by.
Sorry about that. Welcome to filming things at home. But I think what we're all trying to do, right, is to address the racism that exists and the violence that sometimes comes from that racism. And if we're going to do that, let's use evidence-based approaches to address those issues. That's like having counselors in schools. That is funding community programs that can do after-school work, can do things on the weekends, can do things all summer long, right, to help build safer and healthier communities. The evidence actually shows us that the increasing funding to the police doesn't create safer streets. It doesn't get rid of racism. It doesn't address the root problems. And so if we are going to figure out where our money is going to go, where our taxpayer dollars are going to go, I'd rather give it to the stuff that works than the stuff that isn't.
Right on. Yeah, great. So the election is September 1st. It's, we're kind of coming up on the home stretch. You got about a month, right?
As of tomorrow.
Okay, cool. Any chance of a debate between here and there? What's the situation there?
We are incredibly hopeful that we'll have a debate with Congressman Lynch. There have been many opportunities, and people have approached my campaign and asked if we would be willing to have a debate, and we have said yes to every single one. I'm hopeful that we'll get one scheduled within the next few days. I think that is the only way and the best way for the people of this district to be able to hear us side by side and figure out which is the right value set that they want representing them in Washington.
Right. Boy, I'm getting the sense, he said he hasn't updated his website in like 7 years. I'm guessing he, by and large, hasn't really acknowledged your campaign, with the debate. That more than anything should be indicative of the constituency that, he doesn't seem to be engaged, right?
I think it's very clear to folks across the district that he's not engaged and he hasn't been engaged with people. He hasn't, in the past 4 years, he's really only held one town hall, and that was after tremendous pressure from people across the district to get him to actually listen to constituents and hear what they had to say. I will say that he is hearing this campaign, and he has certainly responded in ways, picking up some public appearances, using social media a little bit more. And I think that is a sign that our campaign is working. People are listening to us, and he's feeling some of that heat. So I'm hopeful that will translate into an actual debate where the two of us are on stage together, face to face, and we can share our perspectives.
Right on. So September 1st. And the reason I pull up that is D+10. It's one of those situations where, you said right out of the gate, it's a progressive leaning district, right? It's, why would you not have the fightingest fighter of, on the ticket, right? Why would you go for, the guy that's anti-choice? You say pro-life, I say anti-choice, right? Why would you go for the guy that's, voted against the ACA versus the guy that's trying to get universal health care during a freaking pandemic, right? Seems like a kind of a no-brainer. So how can people get involved? How can people help?
The best way to get involved is to go to our website, robbieforchange.com, and there people can sign up to volunteer. We are making thousands of phone calls every night all across the district. We are texting people all across the district. We are hosting meet and greets and gatherings to try to bring more people into this campaign. And I'll also say at the top of that webpage, there's a big button that says contribute. And for people who can, I know it's a hard time, but for people who can, unfortunately, it takes a lot of money to run a political campaign, especially against someone who has a lot of corporate PAC donations. And so if people can make a donation, there's a way to make that on the website.
Right on. And it's robbieforchange.com.
Absolutely.
Yeah. Well, I thank you for taking some time to chat with me about your campaign and your race, and hopefully we'll get you, into the House. And thank you for running. Thank you for your service on the front lines during this pandemic. That can't be overstated how much of a challenge that is. So it's appreciated. So thank you for all of the aforementioned.
Well, thank you for having me on the show. And how about when I get into the House, I'll come back and we'll do this again.
Oh, I would love that. I would love that. Cool.
Perfect.
All right, Robbie. So Robbie for Change, go check him out, donate, send some texts, send some emails, make some calls, and vote on September 1st. And go hassle Stephen Lynch for a debate. Send him a note saying, why aren't you debating, you coward? So do that too. All right, cool. Thank you, Dr. Robbie.
Thank you.